Hypercholesterol.
Ms. Idalia Garcia is visiting her physician, Dr. Javier Sainz. She might battle health issues, but she has bigger problems that she doesn't even realize. A combination of bad government decisions and bureaucratic bungling is creating a medical emergency for thousands of Texans like Ms. Garcia and the doctors who care for them. So Texas physicians are calling on state leaders to take emergency action to protect their patients. Ms. Garcia is insured by both Medicare and Medicaid, so she's called a dual-eligible patient.
These are patients who are old enough to have Medicare and who are poor enough to qualify for Medicaid.
It's the patient that doesn't have all of these, any real kind of income, that's just living day to day.
But they're the nicest people in the world, and they're very humble. And I've had an honor to treat them for the last 26 years.
Dr. Sainz has cared for so many people here and is such a big part of this community, they named a school after him.
But unfortunately, unless things change, I'm not going to be able to do that anymore.
And it's Medicare and...
More than half of all patients Dr. Sainz medical practice sees are dual eligibles. He and his 3 doctor partners see 5,000 of them. Many of them live here in the valley. But the people who should pay the medical bills of dual eligible patients, the state and federal government, are not paying.
19 patients seen. We billed $3,000 on those because we use regular billings. They allowed $592, the amount of deductible, $592. It all went to deductible, meaning we got paid $0, so amount of check, $0.
Dr. Sainz has many more examples of unpaid bills. He's caught in a squeeze between the state, which in January cut Medicaid payments, and the federal government, which oversees Medicare, and the billing entities that manage the money. When Medicare/Medicaid dual-eligible patients see the doctor, Medicare is their primary health insurance. But Medicare won't pay the doctor bills until they exceed the patient's $140 deductible for that year. Medicaid used to pay that deductible. Now Texas won't pay the entire deductible or the coinsurance. Plus, the Medicare and Medicaid computers aren't talking to each other correctly. So right now, Dr. Sainz and hundreds of Texas doctors like him are getting nothing from Medicare or Medicaid. It's causing a medical emergency. Dr. Sainz says it takes more than 3 visits by one patient before his or her deductible is met and Medicare begins paying the bill again. Until then, it comes out of his pocket in free care.
We have not been paid. Essentially, we have not been paid, and we have lost close to $50,000 in deductibles. That means that we have not been paid and have lost or said goodbye to $50,000 over pretty much a 4-week period.
Yet he still has to pay a team of 25, the 3 doctors and the rest, plus utilities and other expenses.
I've had to go through my personal money to be able to keep my office open. If I had no savings whatsoever, this office would have closed 2 weeks ago.
It's like we're being hit on all sides, and this is just one more area where we're being hit.
He's trying to get a loan to keep his doors open for all of his patients. The Garzas, patients here for 2 decades, are worried Dr. Sainz won't be able to continue to care for them. Their daughter brought them in today.
These are elderly people. They don't work. If they're going to take away their assistance, how are they going to help themselves? Who's going to be the first doctor that can see them if the doctor is not getting paid?
The Texas Medical Association is hearing this outcry from doctors all across Texas, including here in the Rio Grande Valley.
The crisis that these doctors are having financially isn't a reflection of their business acumen. It's a reflection of their commitment to take care of patients that are poor.
Patients like Mr. Felipe Garza, who suffers the ravages of diabetes. Like him, many have lost limbs and have skin ulcers because their disease went untreated for too long. His doctor, Dr. Noe Oliveira, also is fearful about the effect of the government's budget cut and mistakes. He says if doctors like Dr. Sainz are forced to stop providing preventive care, more patients across Texas will suffer.
You just cut real live human beings, real live United States citizens, Americans. You just cut them monetarily and will be cutting them physically.
He'll be 90 in September. So these are your dual eligible patients. Yeah. I'm 20 miles from my home. I was born and raised in this area. I grew up with most of these people. Okay. I came back to care for these people, and they're my people. Muy bien. How do you explain that to your patients? And how can you tell someone that you've taken care of their parents, and you take care of their children, and you take care of them, that if all I see are my most needy patients, I can't stay in business? And if I can't stay in business, then I can't help anybody.